doing bone marrow to inject to your joints for osteoarthritis. He uses also fat stem cell and technology too, the use of photoactivation. The advantage is low bright morbidity. So when you harvest bone, sometimes you have pain many years later. But from fat, when you have been harvested, you will notice that it's used for myocardial infarction. Kasama na yung naka-vessel bypass, naka-stents, multiple stents, and of course, cardiomyopathies. Those who have undergone, by the way, there is a new technology coming in here from the US, from Utah. That technology is more specific also for the heart and erectile dysfunction. So those who have erectile dysfunction, you don't only have hope, you have something to really work on, because these are technologies that are now very, very popular. Now, the advantage of stem cells is that they grow new blood vessels. That's why it's good for strokes, heart attacks, and those with vascular insufficiency, especially of the lower extremities. Now, let's go to this. This is very important because a lot of doctors, when we have patients with heart attack, they have severe pain in the chest, very severe pain. And routinely, we used to give morphine. Now, the severe pain is nature's way of waking up stem cells. Now, if you stop the pain by giving morphine, you will notice that you will be killing 35 to 50% more of your patient. So, it's better not to give any medicine for pain or give a medicine that is not morphine. Much lesser intensity for pain relief. So this is what they're doing now. It's from adult stem cells from fat during liposuction that is now being used to generate new blood vessels. Of course, this is what I do in the clinic. I inject fat stem cells. I inject PRP, platelet-rich plasma, with stem cells inside it. Remember, the blood has 10% stem cells, especially progenitor cells. That's why they're very effective doing platelet-rich plasma therapy. And this is nice. A disease which we thought has. There is no standard medical treatment that can address either problem adequately, yet all those who had undergone stem cell therapy had improved. When there's no hope, especially in autoimmune diseases, stem cell can give you the answer. All the patients in multiple sclerosis improved. Those with difficult case like this, psoriasis, given all the medicines, not improving, on stem cell, they improve. And that's only one treatment on stem cell. So most of the stem cells are just sleeping. They're waiting for it to be awakened, if you have the technology for that. Now, the technology is available in the Philippines to wake up stem cells. Now, this is the question which a lot of you will ask. Is it really that expensive? Is it really 4 million, 5 million? If I were the Secretary of Health, I will study this more, and maybe I can bring it down to very, very, very cheap. I did not say cheap. I said very, very, very cheap. If you understand the technology. The cheaper technology now is 750,000. It can still be brought down to very, very cheap. Anyway, let's go back to the goals. Our goal is this. These people have been stem celled, but the dog was not stem celled. That's why you notice the dog is not moving. Anyway, we are the ones endorsing autologous adipose-derived and more effective methodology. You don't have to stay in the hospital. It's only 3 hours or 4 hours. Walk in, walk out. It's done inside the theater. In 1 hour, 20 minutes, you're eating already your breakfast or your lunch. But it takes some time to process your blood and return it by intravenous drip. To take about 1 hour. So normally, the whole procedure is about 3 hours. If I'm the one who does the process, it's 2 hours and 20 minutes. Finished. Now, no, we're talking to you. We do pulsed sedation. Pulsed sedation. We do consent. We put in NSS 1 liter with anesthesia, local anesthesia. And we do pulse sedation. If we put a needle in, we let you sleep for a few seconds. That's why 90% of our they have, kailan kayo magsimula? Tapos na kami. Any other concern before we? So, for those of you who have heard of stem cells from animals, from plants, that is not going to be good business because the DOH is very, very strict on that, and the FDA. It has to be from your own body, and that is the best. If it comes from fat, bone, or other forged scanner, use 5. All of them have no cost, and it works. Faith, belief, prayer, laughter, and love, especially the love of the people around you. Stem cell has been called by Secretary Ona as the medicine of the future. Using your body to heal itself. And that's why we're very enthusiastic, like me, because I am more in, I feel happy and comfortable in doing stem cells. And I have seen all the improvement. I was stem celled 3.5 months ago. And my biggest problem is I was doing a presentation in Davao for the Philippine Hospital Association, and the surgeon, the cosmetic surgeon, Derla, he did blepharoplasty on me. Can you imagine? I was doing a presentation like this with sunglasses, and the only thing I could see was my feet. Kasi maga yung mata ko. But I feel, I'm 64, and I feel just like less than 30. Now, it's up for you, what you want of your life. But if you don't want to take medicines, the best option, of course, if you can afford it, stem cell. Any question? Maraming may question dyan eh. Kasi sa stem cell. So many people have questions on stem cell. By the way, very, very safe. The procedure is very, very safe. Now, I have done more than 100 adipose-based. I am one of the doctors who has the most number of stem cells. Kasi I'm the one who processes, and I am the chairman for accreditation and competency for the society, for the Philippine Society for Stem Cell Medicine.
Can you use it for young people?
Yes, we're doing for autism. We're using it for very young people. Those autistic, except for those who have published themselves. They show themselves on TV and proclaim. But kami, we have a confidentiality clause because we don't talk about their names. So we can talk about the disease, but not their names. Erap was Baba Black Sheep. But he's still using many other forms. They don't stop with one. By the way, there are so many failures with that. I'm now treating one patient who was shot 4 bullets went to his body, and it hit his spine. He has already gone through bone marrow. He has already undergone